because the effort is too involved in whatever the immediate problem is. So we need to change our whole focus, and it's not being, in my opinion, adequately discussed. Chronic disease management has got some discussion in a very important way, I think. That is the probability of including what is called studies in cost effectiveness. That is, for example, if you have a prostate cancer as a man, you haven't the foggiest idea what to do, whether you should have it surgically removed, radiated, or what, because there are no comparative studies that can tell you which works best. We have many medications, new medications on the market. We have no idea that they're any better than a much cheaper medication that's already on the market. But sometimes, because we're Americans, we like something that's new. So we need to have cost-effective studies. This comes up with respect to the knee operations, for example. Very important because they're not uncommon as we get older to need knee operations. But what is the best way to carry out that operation? We simply need to have those kinds of studies. Research is hardly discussed. And yet, if we don't have research, we will not get new ideas. We will not solve this terrible problem of Alzheimer's disease. It's estimated we already have 4.5 million people with this disease. We only have 1.5 million nursing homes. So 3 million of these people are living at home with huge burden upon family caregivers, probably some of you in this room, who have a huge job and a terrible responsibility to bear. And yet, we haven't developed the kind of research dollars which we need. Now, in the stimulus package, happily, the NIH did get 10, that's the National Institutes of Health, did get 10 additional $1 billion to devote to various forms of research. But our worry is what happens at the end of the 2-year stimulus package. Will the NIH, the National Institutes of Aging, and the National Institutes of Health budget continue to go up? You have to attract new scientists. You have to attract young people. And the problem is that the average age of a scientist supported by the NIH is about 54. And the average age of a new investigator, that means the first time a young person gets an award, he's 43. What are we doing to young people? How are we cutting them out of science? So there's not enough attention, in my opinion, being devoted to research and development. The next is drug safety. I'm not talking about mistaken dosage, which can happen in hospitals or in your own home. I'm talking about the fact that some medications just don't work for you. And the sad truth is, from one study, which is just shocking to me, that there are 100,000 deaths in the United States every year, drug deaths related to drugs. Not because the wrong dosage was given. It's just the wrong drug for you. That's huge. It puts it in the top 4 causes of death. So we think we're doing something that's therapeutic, that's going to help us, and we wind up with death. So we have to have better studies, what's called post-marketing surveillance. Once a drug's on the market, we have to study it. That's, you know, we run into the Vioxx, we probably have heard of, which turned out to be a killer drug of heart. Yet that was not its original purpose or expectation. So we have to have techniques for following drugs when they go on the market. When a drug gets on the market, it's only actually been tested, on average, in 3,000 patients. In order to pick up liver toxicity, which is the most common problem with drugs, you need at least 30,000 patients in order to pick it up, just the way it is, the way nature works. Nature doesn't give away its secrets all that quickly and all that easily. So we really do have to have attention to drug safety. And I haven't heard this be discussed. And finally, the caregiving issue itself, which I've already touched upon, must be explored, and there must be some means of providing more support for families that bear this burden. Their contribution to the gross domestic product is tremendous, and the extent to which they are not able to be parties to our economic growth and development is, of course, striking if they have to leave work in order to take care of their mom or grandma. Next. So we spend a heck of a lot of money in this country on healthcare, more than any other of the industrialized nations. And it's going up still more. So it's more than twice as expensive as Canada, Germany, Great Britain. In fact, Europe spends between 8 and 10% of its annual gross domestic product on healthcare. We spend 16% and are approaching 17%. In other words, we spend twice as much, and yet we do not include everybody in healthcare. All of Europe they do, and it's not socialized medicine at all. It's the only socialized medicine I'm fully aware of is what happens in Great Britain and in our own Veterans Administration. We've had socialized medicine since the 1920s, where doctors work directly for government in our Veterans Administration hospitals. If we did not have the Veterans Administration hospitals, we would have no medical education in the United States. They provide the bulk of education in this country. All of their records, all their health records are electronic. So if you're sick in Oregon or New York and you're a VA beneficiary, they can tell exactly what's wrong with you wherever you are. The VA has been surprisingly effective. A lot of this notions developed because of the Walter Reed situation. Many people didn't distinguish between military hospitals and Veterans Administration hospitals. Military hospitals at Walter Reed was terrible in terms of what happened to returning veterans. That's not the same as the Veterans Hospital. Next up. Next up. Next up. Next slide. Now, who do you think is the biggest lobbyist in Washington? Healthcare, pharmaceutical industry, commercial health insurance industry, American Hospital Association, American Medical Association. All of them have their own special interests, and their interests are not necessarily yours. And that includes the American Medical Association, which, for example, for years carried cigarette ads, constantly opposed Medicare, for example, and is just barely involved this time around. So we do not have a great American Medical Association. In fact, fewer doctors belong to the AMA than do belong. I do not belong, have never belonged to the American Medical Association, because I never felt it properly represented either the needs of doctors or the needs of patients. And so we got a tough business here with this health care